So, hi, I'm Krishna Rayapudi. I'm a gastroenterologist, and we're discussing colon cancer here. And what about symptoms and diagnostics? So, by the time you develop symptoms, it's usually late in the disease, but there are symptoms though. Blood in stool, people ask me all the time. Could be left sided tumors, the left sided ones, but right sided ones bleed silently, usually causing iron deficiency anemia. Then, what about your change in bowel habits, like diarrhea or constipation lasting weeks? That could indicate partial obstruction of the colon, which could be in the sigmoid colon, which is the left side, left lower part. And what about unexplained weight loss? When that happens and we're thinking colon cancer, I'm thinking advanced disease, maybe even peritoneal spread at that point. But when there's symptoms happen, we grab our scope with high definition imaging. And there's also other imaging studies sometimes that point to colon cancer, which may show an ulcerated mass or apple core lesions, is what we call. These are classic X ray signs, but usually nowadays these are detected early, but still you could see it in some parts of the world or in people who are not getting it till they're advanced. You can see it on imaging. So then when you're biopsying, we're looking for MSI status, which is called microsatellite instability, that guides your immunotherapy options. And what about CEA levels? A lot of people ask me about that. We track them post diagnosis if you have a diagnosis of colon cancer. But to make a diagnosis or for screening, it's too non-specific. And then what if there is tenesmus, which is like a feeling of incomplete evacuation when you pass stool, or there's pencil thin stools? Then it could be rectal cancer that's knocking on the door. So what's the edge with the gastroenterologist or me doing it is we catch flat adenomas and serrated polyps, which could be easily missed, and we look for those very carefully. And but if you develop symptoms, it's time to really dig in and don't wait. Get your scope done and screen for that colon cancer and sort it out fast, because symptoms usually indicate later disease. And so get screened for colon cancer.